Hello, everyone. Thank you so much for joining us for this edition of Talking Kids Health. I'm Beatrice Canals. Parents, chances are you've gone through this, unfortunately, many times before. Your child becomes ill, perhaps they have a high fever or they're sick to their stomach, and you have to race over to the doctor's office. If they're really little, chances are they're in the back seat, you're driving, you can't wait to get there, you wish you could be comforting them. It's really heartbreaking and difficult for us as parents. Well, now, thanks to the latest technology, the doctors here at Nicklaus Children's Health System are coming to you. And there's a device that's a real game changer. I'm so excited about this. Dr. Vanessa Guerra is with us here today to talk about this. She is the medical director for the telehealth program at Nicklaus Children's Health System. Thank you for being with us, Doctor.
Thank you, Beatrice. Thank you for having me.
We love to have you here, and we love the news that you're giving us today because it's going to be helping parents and patients so much. About the telehealth, we know that Nicklaus Children's Hospital truly has pioneered many telehealth pediatric programs. Tell us about that.
So we've had several programs in place as far as our telehealth program. We are involved in the Miami-Dade Public Schools. We have several programs that have been implemented in the hospital as far as follow-up care. So we are constantly at the forefront trying to be very creative as far as how we can utilize our technology here at the hospital.
For parents who are watching us now who maybe aren't aware of what telehealth is, explain to them what this is.
So our telehealth program encompasses a lot. We are a source for families to connect virtually with our hospital. So for example, one of our newest initiatives has been the NCHS Anywhere BearCare device, which we will get into soon. But it is a way for families to connect to our medical providers here at the hospital to provide, essentially rapid, efficient, and accurate care for their patients.
So they'll diagnose kids, their illnesses, without you having to leave your home.
Correct.
That is wonderful. You mentioned the NCHS Anywhere BearCare. That's the device I mentioned off the top, and it's really innovative, and I think it's such a wonderful thing for parents. Talk to us about that.
So we have a kit that we call our BearCare kit, and essentially what's unique about it is that it provides a real-time virtual visit with diagnostic capabilities. So the key word here is diagnostic. We have tools that parents are given so that at the comfort of their own home, they can utilize to help the medical providers facilitate an accurate diagnosis. So I've met a lot of families that are very apprehensive about using telehealth services because they want someone to physically lay their hands on their child and provide an accurate physical exam. And so our BearCare kit allows us to essentially put virtual hands on the patient and provide a physical exam so that with the concerns that the parents may have, we can provide an accurate diagnosis and a treatment care plan for the patient. So,
and the parents play a key role in this, and that's because you yourselves will actually be utilizing this device while you're communicating with the doctor. Can you explain the kit to us? We have one here for you so you can take a look at it.
So at the comfort of a family's home, which is nice because like you mentioned, having a sick child and get them in the car and go to the nearest emergency room or urgent care can be pretty taxing on a family. Mm-hmm. And so what this device offers is essentially several pieces where we could essentially have this adapter where we could visualize the patient's ear, and you'll be seeing it through the monitor as well as our BearCare app. And so, like I said, we can look at the ears, which tend to be a very big complaint as far as families go.
So I'm sorry, doctor. So this is the device. If you can't just show them. It's
so
small.
It's small.
Very small.
It's very small, handheld. It'll connect directly to our app. And so we have several appliances that will connect to the adapter. And so one of them, my favorite, is to be able to visualize the ears, which tend to be one of our biggest complaints at parents.
Those ear infections.
Those ear infections. So this is one of my favorite adapters. So the pictures come out beautiful. We have had no issues so far. I mean, they're crystal clear.
Incredible.
It's very user friendly. The parents just have to insert it into the ear of the patient, and of course, there's a safety, so they don't need to be too nervous about inserting it in the ear. So this is one of our devices. The other one that we have. It's very small and compact, and this is actually a stethoscope. So, you're used to having a doctor come in with their stethoscope around their neck, and this is essentially the same thing. It can listen to the heart and also as well the lungs.
So, I'm sorry, so while mom or dad or the caretaker is doing this for the child, the doctor is able to see this?
Yes, at real time, we are able to see and hear exactly what the parents are doing.
Incredible.
Yeah. And so then lastly, we also have our tongue depressor so that we can safely and adequately see inside the patient's mouth because, again, sore throats tend to be one of those
very common
concerns that parents will call in with. And so we'll also have a temperature probe so we can also tell if they have a fever at the time. And like I said, everything is in real time connected to a medical provider.
So once the diagnosis is made and the doctor perhaps feels that the child needs medicine, then what happens as far as a prescription?
So like any telehealth visit, essentially if antibiotics are warranted or a specific medication is needed, then we call it into the prescription, we call the prescription to the pharmacy or send it electronically.
That's incredible.
Yeah.
What are some of the most common diagnoses that can be made with this?
So, essentially anything that a parent can think of that's non-emergent. So nothing that would require an emergency visit, but the common things that we see, I'm a pediatric urgent care physician, and anything that we see, fevers, earaches, sore throats, coughs, rashes, can all be adequately assessed with this kit connected to a medical provider.
And then, of course, I imagine, depending on the diagnosis, you would want to follow up with your pediatrician
Absolutely.
the next day, or if that's necessary, the doctor will let
Yes.
mom or dad know.
We generally always recommend a follow-up visit within 24, 48 hours, regardless of any telehealth
This
visit.
is just for that moment when you need your child to be seen.
Yes, correct.
And you're able to do it that way. It's so wonderful. And for all of us who live here in Florida, we vacation as often as possible if we can, to the beach, etc. Parents can actually get their child seen when you're on vacation. How often have you been on vacation and that's when your child happens to get sick? It happens.
Yeah, so as a mother of two, and a lot of friends with children, I can say that this is probably one of my favorite features. As long as you're within the state that you live and reside in, you can essentially take your kid anywhere you go. So, we are all Florida residents and we have theme parks, beaches, camping, and to know that you can put this in your, you can pack this kit with you and take it anywhere you go and have a medical professional at the other end just ready to tend to your needs no matter how remote you may be is kind of a very nice, puts you at peace.
Oh, absolutely.
To be able to go on a nice vacation.
So NCHS Anywhere BearCare, just to make this clear, as long as you're in Florida, correct? Because this is where we
yes.
reside, then you're able to utilize this device. I imagine when they purchase the device, they'll have it explained to them?
Yeah, so like I said, it's pretty user friendly, but yeah, as long as they download our app either on iTunes or Google Play or directly from our webpage, it's pretty self-explanatory and it easily connects and syncs to our app.
And how can they get the device?
So iTunes, Google Play, or on our actual website, it's NCHSAnywhere.com/BearCare, and it's just downloaded very easily.
So all the information is there on how they can
Everything
get
is
it. Cost, as far as cost?
It's moderately priced. It's a one-time purchase, and then you have it for as long as you need it, and it's very easy.
Small price, I would say, for
I
the
would
comfort
think-
of this,
and
again,
for
as
the
I
peace of
mentioned.
mind.
So many times that you have to rush with your child. And if you're a mother or father with more than one child, how often do you find yourself torn? You have to leave the other kids at home or someone to care for them when you can take your child in. You don't have to worry about that. The doctor comes to you at home. I think it's so wonderful. And for now, while parents prepare to purchase their kit, if they're at home, do they have to wait to have that device to be able to take advantage of a doctor helping them at home?
Essentially, a telehealth visit, you don't necessarily need this kit, but as far as a medical provider goes, we spend years perfecting our clinic visits, and part of our visits are hearing all the concerns that the parents may have, but we always feel like we're missing a piece of that puzzle, and so this is that missing piece to the puzzle. So although it's very easy to get care, people tend to be apprehensive because they want us to be able to visualize the concerns, and so this is that missing piece. So
It's a game changer.
it is
It's
a
made
game
a
changer
difference for you.
for families and for the physicians.
I believe it. Well, thank you so much, doctor, for giving us this incredible information. It's wonderful. I'm so glad that Nicklaus Children's Hospital is really putting so much emphasis on trying as much as they can to get the health care to the kids as soon as they can, as possible. If you want more information on this device, all you have to do, as Dr. Guerra mentioned, is log on to NCHSAnywhere.com/BearCare. All of the information is there about the app and the device that can hopefully change your lives as well. Thank you for joining us, and we hope to see you again next time on Talking Kids Health. I'm Beatrice Canals. Have a great day.